For as long as I can remember, I wanted to become a doctor. Even from a young age, I knew that, and I believed that by impacting people's health, I could give them a path to prosperity. I made this link between health and wealth from a very young age. And to quote the words of Ralph Waldo Emerson, I knew from that age that the first wealth is health. Part of what made me, or helped me make that connection, were some of my experience moving to this country from Ghana at the age of 6. I came with my mom, and like many immigrants, we were in search of more opportunity. And while there were many differences between these two places, I observed one very striking similarity. Both in Ghana and the US, poor health travels with poverty. And vice versa, poverty often spawns poor health. The specific way that I wanted to address this dilemma came to me like a messenger in the night. At the time, 6 years old, I was still sharing a bed with my grandmother. And one night, I awoke to a scene of chaos and commotion. My grandmother had gotten up in the middle of the night and never made it back to bed. She'd collapsed, and she died of an aneurysm. In the days that followed, my shock gave way to grief, and then that grief eventually turned to curiosity. How did this happen? What causes an aneurysm? What could be done to prevent it? What would have helped my grandmother lead a longer life? And from then on, I made it my mission to understand the root causes of diseases like the one that killed my grandmother. And what I learned was that while genetics certainly plays a factor, we are not at the mercy of our DNA. I learned that my grandmother's lifestyle likely played an impact on her health outcomes. You see, it goes back to that link between health and wealth that I observed at that time. And while I knew that link was real and it was powerful, it also wasn't as straightforward as it seemed. You see, back in Ghana, being overweight was actually seen as a sign of wealth because it meant that you had the extra resources to afford an abundance of food. But in the US, highly processed foods are so cheap that obesity is often a symptom of poverty. Yet still, we spend $30 billion on weight loss products, and we are still leading among wealthy nations on our obesity rates. It didn't make sense. So if more money was not the answer, what was? I didn't know the answer at the time, but I dedicated myself to a career in medicine to try to unlock the secret. And so for the next 20 years, I focused on that goal. But somewhere along the way, I had this nagging feeling that I just wasn't getting to the root of the problem. And it wasn't until the night before I was meant to take that next step, submit my residency application, finally start a career practicing medicine. That night, I reached a crossroads. And instead of barreling forward to achieve that lifelong dream, I started to ask the deepest part of myself, that child living in Ghana, that young girl that saw her grandmother die. Was medicine still the right path for me? The answer was no. I knew at that moment that if I waited until I laid hands on a patient, it was already too late. If I wanted to have the impact that I knew I could have, I couldn't do it one patient at a time. I needed to find a way to move our healthcare system towards active prevention and prevention through lifestyle. As a medical student, I learned some troubling statistics. Maybe you've heard these statistics. Statistics like the fact that in the US, we spend over $12,000 a year per head on healthcare. And yet we're trailing among peer nations in terms of multiple indicators of health outcomes, including life expectancy. Why is that? It's because we don't have a healthcare system. What we have is a sick care system. At every level, our system is designed to discourage you from using healthcare until you have a diagnosis, until you're already sick. A few years ago, I started to deal with my own mental health issues. And all of a sudden, I was looking at a lifetime of seeing physicians, taking medications. I was on the sick care treadmill too. That is, until I started to see another path. I started to realize that the only way off that treadmill was to invest in proactive health. It was to start exercising and increase my exercise so that my body's own endorphins could improve my mood. It was to invest in better sleep, perhaps by buying a new mattress. I even brought home an emotional support animal so I could add one more tool in my arsenal to improve stress and anxiety. In other words, I started to heal myself through lifestyle. And while a physician in this country is well incentivized to prescribe 300 milligrams of Zoloft, they can't just prescribe you a Peloton bike. Or can they? That's when I discovered that there was actually a part of my health plan that could be used for prevention. And that part was called an FSA, a flexible spending account, and an HSA, a health savings account. All I needed was a note of medical necessity from my doctor. And while most physicians are more than happy to sign off on this type of request, the average patient doesn't know that they have these tools available to them, much less knows how to use them effectively. And that's where I got the idea to start my company, Sika Health. Sika is the Ghanaian word for cash. And we are all about helping you invest more cash into your health proactively. We're working every day to make paying for a massage, or paying for a mattress, or your various wellness investments, making those purchases as easy to buy as a medical copay. My goal is to help all of you create a path towards proactive preventative health. My goal is to create a true healthcare system. And it's about time, because most people are not leveraging these tools to their benefit. In fact, every year, the average worker, overall workers lose about $4 billion in unspent healthcare dollars like FSAs. We're literally throwing away billions of dollars because our system makes it so hard to use the tools that are available to us to invest in our health. But it doesn't have to be that way. We can have nice things. And that's where you all come in as business leaders. As business leaders, we not only have an obligation to provide paychecks, we have a special responsibility to help our employees invest in themselves, and through that, invest in the common good. I'd like to share 3 very tactical ways that you all can do that today. So, three tactical ways. Number 1, offer HSA and FSA programs. In addition to your normal healthcare benefits, HSAs and FSAs actually create the tools, create a path to help your employees power preventative health. Number 2, seed the pot. You as an employer can contribute to these programs on your employees' behalf, creating an additional incentive to engage them in proactive health. And number 3, help them spend. Many employees would gladly leverage these tools if they only knew how to put them to work. And resources like Sika Health's Marketplace can help you do just that. It's time to get off the sick care treadmill. It's time to recognize that healthcare doesn't only happen within the 4 walls of a doctor's office. And as business leaders, we have the ability to help our employees invest in their health through improved nutrition, through stress reduction, through movement, through better sleep. When we invest in our most powerful resource, our employees, we create a path to that common good. We create a path to greater longevity for ourselves, for our businesses, and for our country. Thank you.
Think of sharing what you know.